I'm going to introduce your moderator today will be Matt Jewett. He is the returning director of health policy for Children's Action Alliance and my supervisor. He continues to lead outreach campaigns to increase access and kids care, health insurance enrollment, and he recently also oversaw grants for Mountain Park Health Center. He's a graduate of the University of Arizona and has studied graduate level public health at A.T. Still University. So I'll let Matt sort of take it away. If you want to wait till exactly 9:30, go ahead. If not, let's start now. We have all our panelists.
I think we are very, very close to 9:30. So thank you, Brianna, and thank you, everyone. And I am very excited to get to moderate a really exceptional panel, and I look forward to hearing what they will share with us. Arizona is impacted by widespread prevalence of oral health disease. And as we know, and as we've just discussed, there are serious inequities that unfairly burden certain populations, including racism and specific inequities facing ethnic and racial minorities, veterans, older adults, and individuals with low incomes. These inequities are rooted in social determinants of health, and policy change is a crucial step to make those significant changes. We have a lot going on in the oral health landscape right now. We have a lot going on in the broader public policy landscape, so we can certainly bring that in as well. I want to introduce our panelists who will be talking about this. First of all, let me pull up our bios here. Zaida Dedolph-Piecoro currently serves as the health policy advisor to Governor Katie Hobbs. Prior to joining the Hobbs administration, Zaida was the health policy director at Children's Action Alliance. I have big shoes to fill. She has held positions in several Arizona nonprofit organizations advocating for an end to poverty, hunger, financial exploitation, and domestic violence. Zaida earned her bachelor's degree in anthropology and bioethics from Loyola University in Chicago and a master's degree in public health from the University of Arizona. Will Humble is a longtime public health enthusiast, to say the least, and is currently the executive director of the Arizona Public Health Association. His 40 years in public health include more than 2 decades at the Arizona Department of Health Services, where he served in various roles, including as the director from 2009 to 2015. Will continues to be involved in health policy in his role as executive director at Arizona Public Health Association. Dr. Tim Butler-Perry is an associate professor and associate vice president of University Strategic Partnerships, A.T. Still University. She served a dual role as the inaugural associate dean of clinical operations for A.T. Still Missouri School of Dentistry and Oral Health, and the dental director and vice president for Affinia Healthcare, the federally qualified health center community partner. She holds a master's degree in clinical and translational research with distinction from the University of Texas Southwestern. Her research includes health disparities, untreated dental caries, and community participatory research. We're also pleased to have with us Representative Dr. Amish Shah. Dr. Shah has served in the State House of Representatives since 2019 and is currently board certified in emergency medicine and sports medicine and practices throughout Arizona, treating adults and children. He attended Northwestern University in Evanston, Illinois, and graduated cum laude with a Bachelor's of Arts in Economics. He also graduated from Northwestern University Medical School as part of the honors program in medical education and completed a Master's of Public Health with a full merit scholarship at the University of California, Berkeley. Dr. Shah won the American Academy of Emergency Medicine's National Resident Research Competition for his work in inventing a new method to provide care for the critically ill. So please join me in virtually welcoming our panelists. I will start off with the first question, and that is, I'd like you all to provide a high-level overview of how oral health advocacy has shaped the work that you are that you do in moving the dial towards access to care? Why is it important to have advocacy as part of your work in trying to bring about health equity? And I don't know if anyone wants to jump in first, or if you want me to call on somebody. I know this isn't a shy panel, but
Matt, let me jump in really quickly. I want to give the audience a poll, and I didn't want to interrupt you. This is just to get the conversation started in the chat, and then please feel free to continue. Didn't want to interrupt there.
Great. Thank you. We'll look forward to that. And we will look for the results of the poll as well. And Brianna, you're going to...
We can't vote, apparently.
Right.
Yeah. No, you all can start the conversation. Go ahead.
I think those of us who are, I think the panelists would skew the results a little. So with that question of how...
Disenfranchised.
Right. Dr. Shah, do you want to start us off with how advocacy plays a role? You're someone who has lived the life of being a medical professional, but you got into the role where you are an advocate also as one of your jobs. So how has that worked for you? How do you see that
Certainly, I've worked in emergency medicine for 20 years as part of clinical practice, and you can see one patient at a time and make life better for them. You can make a difference for them. You can help to heal them. However, before I jumped into politics, I realized I had a realization that while you can treat one patient at a time, you can't change the system as an individual provider. That became clear to me because the emergency department, for example, where I work, I can't control what comes in through the front door. Public policy, politicians control what happens there in the environment that people live in. So that was part of my motivation to run for office, because I wanted to be part of the solution to fix the system. Again, and going back to that master's in public health that I did at Berkeley, that talked about how systematic changes make such a big difference at the individual level. I mean, what we as physicians also want to, we lament the system often. We say to ourselves, why is this happening? How are we, how are we dealing with the problems that the system creates, or ways in which the system falls short? And so that was kind of my entry into it. With regard to oral health specifically, I think the folks on this panel probably know, and maybe the audience knows or doesn't, that this year my bill, the preventive dental bill, was an effort to increase access to dental care for 2 million people on our Medicaid program, and unfortunately it didn't get into the budget. So but we will try again.
Thank you. Dr. Perry, you have been involved in advocacy. You've also been involved in research. How do you see advocacy kind of informing your work? And you are muted, which is usually often a good thing, but we'll pull you off of mute for now, because we want to hear your experience.
Yeah, thank you for asking that. So when I was the past president of the National Dental Association in 2017, my mantra was our place at the table, advocating and advancing for the future of oral health. And for the last 6 years, there's been very little change. Part of our mission at the National Dental Association is, we're promoting oral health equity among people of color. We feel that the lack of oral health care is an equity issue. We know that the Surgeon General told us in 2000 that, oral health directly impacts our overall health. That was 23 years ago. And we know that this underserved patient population, they deserve an opportunity to have a level of oral health care that allows them to chew and eat and maintain their self-respect, as we heard earlier, and find meaningful employment, put a roof over their heads and food in their mouths. And sadly, for me, it requires this level of advocacy to advocate for those who may not be able to help themselves. And we're talking about a population, something that's impacting white, Hispanic, Native American, indigenous, tribal communities, and African Americans. So this level of confusion that continues to be allowed to exist around what patients actually need and what we as states can actually afford is actually perplexing to me. And particularly when we have the data to be able to help us. But what we cannot continue to do is allow this patient population to routinely report to emergency rooms, to include those here in Arizona at the cost of millions of dollars, seeking oral health care that can be prevented. Many of our healthcare providers agree that this does not improve outcomes. And there's this extreme cost, right, to each state. And it contributes to substance abuse, just not here in Arizona, but nationally. So for a patient population that has been refused basic oral health care for so long, and to lead one to believe, while I am excited about the efforts that we've been putting forth, but to lead one to believe that an exam and a cleaning will suffice, that's false. To believe that the underserved Medicaid patient population here in Arizona, to include pregnant women, have some level of adequate oral health care in Arizona, they do not. And it's similar to other states. What they all have is emergency care. They cannot go to a dentist and get an exam and x-rays, a cleaning, or needed filling, as many of us can, unless something hurts, unless it's swollen, there's a cancerous lesion, or something is broken. So why do I advocate? I advocate because of a person born and raised in an underserved community in North New Jersey, not too different from Arizona. And as a dentist who has provided care to this patient population, I understand their needs. And what do they need? They need exams, they need cleanings, x-rays, fillings, extractions, yes, and some emergency care, but they also need people who actually care about them and willing to go to bat for them nationally as well as in Arizona. And some people said to me, I'll end right here, say, Kim, what I'm being told is that we have to start somewhere. But somewhere was an exam and a cleaning, and in 2023, sadly to say, we weren't even able to accomplish that. So that's why I advocate for this patient population.
Thank you. Zaida, I'm going clockwise on my screen. You have been in an advocacy role before, and you now probably, I imagine, in the governor's office, get people who are advocating to you. So you probably have an interesting perspective. So please unmute and let us know why it is that you see that advocacy is important and how advocates can impact oral health in Arizona.
Yeah, I think I also am the only person on this call to hold the distinction of having been both the previous Matt Jewett and the future Matt Jewett at some point in my life. So happy to be sandwiched between Matt Jewett's at Children's Action Alliance. I think that the question that you just asked is really important, and to give a little bit of perspective on kind of my journey here, I think it really starts with, this inability to like unsee injustice, right? Like when you're working in a domestic violence shelter and you're seeing people who are in the worst times of their life and they're struggling with a toothache, that can be the difference between somebody, making that jump out of an abusive environment and going back to it because it has safety, because it has financial security. The same is true across the board. It's the difference between being able to make a full recovery from substance use or behavioral health conditions and not being able to make that leap is really the quality and state of your teeth. And in so many ways, we see people kind of pulled into these cycles of addiction because they're unable to get the care that they need to address the underlying issues. And it's difficult to be able to look at that from the perspective of how the state has traditionally financed its health programs, how the state has invested funding and how it has allocated its budget, and that has really created the social and political environment that we see today, that has made it very, very difficult for really good bills like the one that Dr. Shah had put forward this year to make it through. I don't think that I just answered your question, Matt, but I'm going to talk about the role of advocacy and just say that it's super important at every level. This is a message that needs to be heard, not just at the governor's office, but among legislators, among local leaders, among administrators within these programs as well. And it needs to be very clear the why behind that and the importance that this happened right now. It's been interesting being here. I think that we've received a lot of advocacy on a number of issues that are very important. And when we look back, we realize that that is because people don't feel heard in other venues, and they do feel heard in this office. So I think that that's something that needs to be addressed across the board. But it's also really difficult to advocate for something if that groundwork isn't being laid on the base level as well, at the legislature, at city councils, anywhere where people are in a position of power. So I'll just kind of add that there and say that oral health issues are touching people everywhere, and they're imbued into every level of government: state, federal, local, tribal, municipal. Water policy is something we've been talking a lot about here. And so, it's really, it's something that needs to be pushed among every conversation in every venue.
Excellent. Will, you have been, you've been the director of the Department of Health Services. You've probably also been in that role of people advocating to you. You've had constraints that you've had to work with as a government agency director. You've also been quite a powerful advocate in your own right. What is the importance of advocacy in shaping oral health and eliminating inequities?
Yeah, so I have a really simple and I hope short answer. I'm going to start with one of the things Dr. Shah said at the beginning, which is, like, in clinical medicine, the patient is the patient. Like, you have a patient in front of you, and your intervention might be, they have an earache, so you have amoxicillin or, some antibiotic or something like that, and that's your intervention. Well, in public health, the community is the patient. The patient is the patient. The community is the patient. Okay, so what's the treatment for the community? Well, it's policy. I mean, policy is the intervention. And so the importance, going to your question, like, what's the importance of advocacy? Well, advocacy is just simply the mechanism that you use to get the policy change. And that could be, and by the way, a lot of people think of policy change as being legislative policy change, like getting the legislature to pass something. And I hope to be able to touch on this in the next couple of questions. I think importantly, over the next year and a half, the more important kind of advocacy is administrative advocacy up until January 2025. I think administrative advocacy is the really key. So if your community is the patient, policy interventions are the treatment, advocacy is the mechanism to get that treatment to the patient, being the community. And so both administrative and legislative advocacy are really the keys to improving outcomes. And timing is important. Like, the kind of advocacy that you use depends on the timing of what you can influence. And I think we have a real opportunity over the next year and a half to influence administrative advocacy. And I would put less of an emphasis on, administrative advocacy. I would put less of an emphasis on legislative advocacy up, for the next session, but rather use the efforts to get policy changes within access, not so much DHS. They don't have, they have an oral health plan and all that stuff, but like access is the place. that's providing the care. So I think there are a lot of opportunities over the next year and a half to do administrative advocacy to inform, for example, the next budget about what resources are needed to get the kind of rate increases that we need for oral health, so that we actually have a network, so that when parents want to bring their kids in for cleanings and stuff, that there's actual providers that will take the Medicaid reimbursement rate. So I think over the next year and a half, I'm probably doing the next question now, so I'll just stop. I think I already answered your question for this question.
No, you're helping make my job easier. We're just sailing right in there. So let's talk a little bit about the history of oral health policy and advocacy in Arizona. What have been the major barriers to implementing good oral health policy? What is kind of the history with Medicaid? What are any of the other issues that might affect, besides Medicaid, oral health? And I don't know who wants to jump in take the first swing on that one.
I volunteer as tribute, Matt. So I think that when we're looking at the issue of oral health, particularly within like a publicly financed system, we have to be looking at all of the other competing factors that are there. And this has been something that has been, I know, a source of major frustration for everybody on this call over the past few years. But looking at state budgets and state revenue and how we're able to grow state revenue to finance these types of programs, as well as what the other strains on state revenue are that are contributing to, an artificially scarce environment, I would say. So looking at, this year's budget process, it was very, very, very difficult to get any amount of ongoing new spending into the budget, in part because of a series of changes that have been in the works for years, if not longer, decades, centuries. In Arizona, I think a lot of the folks on this call know it's very easy to cut taxes with a simple majority of votes. It's very, very difficult to raise new revenue by any means without a super majority of votes. And if you've looked at the makeup of our legislature lately, it is not, it's not easy to get a super majority of anything in this political climate. So when we're looking at forecasted budgets and forecasted available funding, we need to be talking about the fact that that we have continued to cut taxes really recklessly, and to make changes to how the state garners revenue that make it virtually impossible to finance new projects, even when they are desperately wanted and needed by the state. So I think if you're looking at oral health advocacy, you need to also be looking at what we're doing on revenue, how we can get creative, and that supermajority requirement is true across the board. So it's not just new taxes on individuals or on income. It's true of any new project that would bring in a significant amount of revenue to the state. So that makes it really, really difficult to forecast. It makes our state really, I think, vulnerable and susceptible to financial recessions, which is where we see these big cuts, particularly within health and human services. And it makes it very, very difficult to come back from that. So it ties in with education, it ties in with public safety, it ties in with every other competing need in our state. And it's something that we need to be looking at holistically and trying to find creative solutions and pathways, and also just paying attention to all of those other issues as a component of our ability to make this kind of change happen.
We have a very active chat as well with this, and while we don't have a Q&A session portion in particular, I think some of the themes I'm seeing is a little bit of frustration of not having a seat at the table. And if we've been advocating, why are we still advocating? And so, Will, you've, as your bio said, you've been at this for a while. So what is it that we can take heart in? What is it that's our history that we can learn from?
So I want to talk about some good things that actually have happened. So it starts with a really bad thing. So back in that last recession, and Zaida, you talked about how bad recessions are. So when I first started that director job, we had that horrible recession in 2009. And that's when, back during that Napolitano era, there was actually a pretty decent adult oral health benefit under Medicaid. And that was completely wiped out. I mean, to zero during that recession. Thankfully, CMS requires kids up to 21 have oral health coverage, and they were unable to cut that, or they would have. But on the adult side, everything got cut, and it stayed that way for a long, long time. And by 2015, I had left state government, and then we were back in an advocacy role where I was able to do that kind of advocacy. And the first advocacy that we can take heart in is that we actually got the governor to agree to a $1,000 benefit, which isn't a ton, for at least emergency dental benefits for persons with developmental disabilities. That was the first success that we had back in 2015. In 2015. In 2016, we were able to expand that emergency dental benefit, or maybe it was in 17, to get at least an emergency dental, $1,000 emergency dental benefit for adults. And so there were some minor successes with advocacy during the previous administration. But I think what we can take heart in, and we had limited success, quite honestly, with getting the Medicaid agent access to look at the network sufficiency and so forth. In fact, you guys at Children Action Alliance, did their work for them, looking at the network of care and the network availability for under the kids Medicaid program when Simon was in your position. And so I think now we have a real opportunity over the next year and a half to give data and information to Access and the governor's office about what's needed to build network sufficiency on the kid side. And what it would take in terms of reimbursement to incentivize, dentists to actually start taking Medicaid kids, especially in some of these rural and more underserved areas and so forth. So now is a real call to action for all of us to get the kind of information over the next few months and get that both to Access and the governor's office so that they have better information to build the case during the next budget for what's needed in the Access budget, especially on the kids side, to improve the network so that parents actually can make an appointment. It's like if you have coverage under Medicaid for dental and you're a mom and you can't find anyone that'll give you an appointment because you have Medicaid insurance, that's not coverage. You don't really have coverage. It's on paper only until you can make an appointment to get your kids' teeth cleaned and stuff and fixed. So, I think the call to action is administrative advocacy over the next year and a half, so that so that Access and has the opportunity to build the right budget. And and I heard Zaida in a different forum earlier this week talk about how this administration was stuck with the agency budgets that were turned in during the Ducey administration. And we can change that now so that when the budget requests, which usually go in October, have built into them what's required to actually meet on the kids side, there's an acronym for it, but the kids' oral health standards for what you're supposed to meet under the Medicaid requirements, and put in that budget request so that then the governor's office has the ability to hold fast to that when the budget negotiations come. And with Medicaid, we've got a lot of leverage. I mean, yes, there are budget constraints and stuff, but with Medicaid, we have the advantage that, you've got the federal match that can really make a big difference with even a small increase in state contribution.
So the question was on on barriers to advocacy, and we do have some, there's a feeling like, gosh, we've been advocating for this for a while, and Will did point out some successes we've had. Dr. Shah, you mentioned your bill that, while it didn't make it into the budget this year, to provide adult coverage, including pregnant coverage, oral health coverage and access. That's something that has been run in the past specifically as a pregnant only, with the idea that we're building little by little. And this year we just went for full adult. And whereas that bill hadn't even moved in the past, it made it through the entire House and made some decent progress in the Senate. What do you see as the barriers? What do you see as the opportunities, and kind of what advice do you have for us as we go forward advocating?
I think we should try again. That's my simple answer. I think money, and with due respect to Zaida, and I understand there was a lot of consternation about the ongoing portion of the budget. I'm on the Appropriations Committee as well in the House, and I understand that there was that concern that we would not be able to increase any ongoing funding this year. I understand that. I still think that there's a chance to find money there in that ongoing pot, if we look carefully through the budget. And I think that this is important enough to the population of Arizona that we should be pushing this forward. I can only say that one of the biggest reasons I wanted to push this bill forward as one of my top priorities for the year was because it's low-hanging fruit. You want to if you spend the least amount of money and help the most amount of people, then you've got a really good policy on your hands. To Dr. Perry's point, is it perfect? No. Does it include restorative? No, it doesn't. It includes x-rays, cleanings, exams, and fluoride. But that's a start at the amount that we have. And I really think that you have to think about what is possible, both structurally from a budget perspective and actually politically. And I will point to the hearings that we had on this bill, where I had members of the other party. I'm a Democrat, by the way. So there are members of the other party who spoke highly favorably of this bill all the way through the process. And so that's how I know that there is political will to get it done. And now I think we've made a lot of momentum. We've made a lot of relationships happen. We've convinced a lot of people of this idea, and that just means push again. And hopefully next year, maybe the budget situation might be a little different depending on how revenues come in and what the financial picture looks like for the state. But I believe that we can get this done. And I'm somebody who I'm a pretty realistic guy when it comes to legislating.
Great.
I just want to say, Dr. Shah, we really appreciate your efforts. So as the chairman of the board of the National Dental Association quarterly, I have the opportunity to meet with CMS, Centers for Medicare and Medicaid, and with their top dental leadership. And what was recently shared with me just as of last week, about 3 things that's important that other states have done to get oral health care across the line. And one was ensuring that we had access to the right data. So we heard a lot about that today. So we can present that to our legislatures, to our administrators and our leadership at a level that they can understand, and to help them connect those dots, right? Having the right individuals at the table. There was a lot of talk in the chat about who needs to be at the table and what that oral health coalition should look like. And thinking more broadly and being inclusive is important. And what that does, it ensures that if there's any group or entity that cares about this patient population, who understands the why, right? And who would benefit from this population actually receiving adequate oral health care, those are the people that we need to consider being at the table for our oral health coalition. And lastly, they talked about, and we've talked about it here, having a solid knowledge of the legislative policy and processes. And I really feel that that's a piece that we do have in place. But I just wanted to share with you that national perspective that I received from CMS.
So we've talked, so now let's get into maybe we've started talking about the future oral health strategies. What what's next? I guess, where do we go from here? What are some opportunities? Legislatively, Will hinted at things beyond legislatively. We heard people talking about getting access leadership to come to the table. And what progress have we made this year that we can build on? And I'll open that up to whoever wants to take a swing at it.
Yeah. I'll just say, carpe diem, seize the day. I mean, we have now we have someone in the governor's office now that cares about these issues, and that hasn't been the case for a long, long time. So my attitude is, let's seize the moment and use the allies that we have in that executive tower to do things that Access already has the statutory authority to do. They just need to change the policies and put in a responsible budget request. So my attitude is, between now and January 2025, let's seize the moment and leverage the friends that we have in the executive tower for issues like this. And quite honestly, it's been a long time since somebody was behind closed doors asking the staff over at Access, what's up with the kids network? What is it that we need to do to improve care in Safford, in rural places like that? It's been a long time since that kind of conversation has been happening behind closed doors. Now it is. So my attitude is, let's focus on administrative things within the Access agency between now and the next election. And then if we can flip a couple of these districts, then we can really start talking about legislative advocacy and getting a more comprehensive adult dental benefit in the 2025 session, and back a decade.
Right. That's right. Quality is definitely important, and we can work with administrative advocacy on that. Anyone else want to talk about kind of what some possible next steps are?
I'll go. So I want to highlight, the state is under new management at the executive level, at the Access level. Director Heredia is very supportive of all kinds of oral health integration, behavioral health integration, is a smart and wonderful human being. And I think that she would be very receptive to this message. I'm happy to help facilitate that meeting or any others that I can moving forward. I will, now that we have the ability to message everybody, I will put my email in the chat. Feel free to reach out. And I'd love to keep this conversation going ahead of when agencies submit their budget requests. We can't make any promises, but let's talk.
Right. And that is a process. From when I was at Children's Action Alliance before, we would always go down around September to the Governor's Office of Strategic Planning and Budgeting and see what agencies had included in their requests. I believe that's actually online now. We used to have to pay 15 cents a copy and go into a special room. So it's good that somebody is looking at what's happening, that advocates are looking at what's happening at the very beginning of the process when agencies put that in. Do you think, Zaida, that helps? Or Dr. Shah, do you think that helps if an agency comes forward and says, yeah, this is in our budget request?
Certainly it all helps, right? So it's anybody and everybody adding to the conversation always helps. I do believe we have the opportunity to get it done, and just the more we start speaking to people and getting more people on board and just building the momentum, we will continue to do it. I will introduce this bill again. I'm going to say this right now. I'm going to introduce this bill again.
Great.
Ben, if I can jump in here as
Please.
well, in terms of, where we're going to go. I just think that, if we knew better, we would do better. And I think education is key. And I think believing that providing an oral health benefit to this patient population could be life-changing for them. I believe that, the literature tells us that, for you to have a healthy body, you need a healthy mind and healthy mouth. And oral health care is tied to so many things: hypertension, diabetes, cardiovascular disease, respiratory health, adverse birth outcomes. So is it that the integration is key for our administrators, our leadership, our legislators to understand? I mean, for example, if you look at diabetes, right? If we're not treating dental disease, or this is what the research sort of shares with us, if we're not treating dental disease or oral health disease, we're not treating diabetes, because they're interrelated. And diabetes costs this country Arizona $6.8 billion annually. 5.1 of those dollars goes towards direct medical care, and 1.7 goes towards indirect, like absenteeism, low productivity, early disability. And then you take COVID on top of that, and how that has impacted the diabetic patient, particularly African Americans, Native Americans, Indigenous, and Hispanic populations. So then I have to say, do the legislatures or the leaders know that 66% of the diabetic patient here in the state of Arizona has hypertension, right? So is there, and then those who have hypertension have poor, and diabetes have poor oral health or gum disease. So can getting them to the dental office help us to identify these diabetic patients, these hypertensive patients, so we can refer them to care and hopefully reduce some of the costs that we are incurring? I think it's important that we connect the dots for folks, because if you don't do that, they'll connect their own dots. So does this mean we're asking for crowns and bridges and implants? No, but let's start with the benefit that provides what is urgently needed for this patient population. And that would be exams, preventive cleanings, deep cleanings, and additional cleanings for the diabetic patient, right? And who has periodontal disease or gum disease. This benefit would allow for fillings, extractions, and yes, a reasonable replacement for missing teeth. And I would also ask that we allow our oral health experts in the state of Arizona who have care for this patient population understand their needs, help to define or decide what will a comprehensive dental benefit and what that could possibly look like. But what would the initial comprehensive dental benefit? Where's the start for us that we can build upon? The other thing I want us to remember is that community health centers are safety net providers for these patients. Can we consider allowing them to receive their care in community health centers where the care is integrated and is patient-centered? And lastly, I will say that we need state data to help determine these needs. Let's not let it be so difficult for those who want to advocate for our medically underserved patients not be able to obtain this data. So let's begin to figure out how we can turn some of these no's into yeses for our community, because they rely on us, right? It will have the potential to save lives and reduce the cost to taxpayers in the state of Arizona now.
Excellent. Thank you, Dr. Perry. That inspired me to go forward. Someone who, between my stints at CAA, was in the federally qualified health center arena. We were very proud of the fact that you didn't even have to make it a separate visit. We could go in during the pediatric exam. So many kids go to a pediatrician before they go to a dentist, and we just put it all together right there. And also, I just want to say for Children's Action Alliance that for those who ask why we're so supportive of an oral health benefit for adults, it is because number one, well, for one thing, we've always cared about adult coverage because we know that families often apply for their health coverage together. It's when you apply for access, you all get your family coverage together. We also know, as we've talked about, for pregnant patients, it's the link is so there between maternal oral health and better birth outcomes. And also we know that oral health disease tends to, families are sharing an environment. So we need to have care for the whole family. This has been an incredible panel. And I think someone said, I don't remember if it was just to me as the moderator or if it was to everyone, that we're not going to solve everything today. This is really just to kick us off. And I also saw that Tara has in there the mention of Dr. Perry, and also the for anyone interested in joining the advocacy committee, that's a wonderful opportunity. Any closing 5-10 second beyond Go Adult Oral Health Benefit? And let's continue this conversation.
Thank you.
Thank you to all of our panelists, and I will turn it back over to Brianna.
Thank you. Thank you so much. I just wanted to, again, thank Matt for your wonderful moderating. You really pulled out a really engaging conversation, and there's so much work to be done, but it's so inspiring to see all of these great panelists and just all of you who continue to fight the good fight for oral health. So our poll was very interesting as well. It looks like the majority of folks who answered the poll had participated in an advocacy action this year, which is really, really exciting. We'll hear a little bit more about opportunities to participate specifically around that adult dental benefit later on when we do our coalition update.